Turns out, exercise and HIV. For decades, doctors told people living with HIV to take it easy. Rest, conserve energy. Your immune system's already fighting for its life, so why exhaust it further? It made intuitive sense. It was wrong. And when researchers finally tested whether exercise could actually help these patients fight not just HIV, but the constellation of diseases that come with it, diabetes, heart disease, cancer, they found something so counterintuitive that it basically flips the entire medical playbook on its head. So here's the question. If vigorous physical activity could be more effective than some medications at preventing serious disease, why aren't we treating the gym like a pharmacy? For most of medical history, HIV meant a death sentence. Then came antiretroviral therapy in the 1990s, and suddenly people living with HIV could live decades, not months. But here's where it gets complicated. Yes, these medications keep the virus suppressed, but they don't erase it. The virus stays dormant in the body, and that chronic inflammation, that constant immune system activation, starts wearing you down like water against stone. People living with HIV started developing heart disease earlier than their peers without HIV. They got diabetes at higher rates. Some developed certain cancers more frequently. Doctors realized they'd solved one problem and unveiled another. How do we prevent these secondary diseases? The assumption for years was that HIV patients needed to protect themselves, rest, avoid stress on their bodies. But what if the opposite was true? What if the thing that seemed dangerous, pushing your body through exercise, was actually the cure hiding in plain sight? Mwebaze N, Makubuya T, and Nahwera L, along with their team, published their findings in BMJ Open Sport and Exercise Medicine in 2026. This represents collaborative work investigating a question that's only become urgent in recent decades. Now that people with HIV can live normal lifespans, how do we help them actually live healthily? The research synthesizes current evidence on exercise as both prevention and treatment, examining the biological mechanisms that make it work. These weren't just theorists, they were drawing together clinical data, mechanistic studies, and real-world outcomes to build a case for why physical activity should be standard of care, not an afterthought. Here's what they did. The researchers conducted what's called a systematic review and evidence synthesis. Basically, they went through the published scientific literature like they were a detective agency, pulling out studies that tested exercise in people living with HIV. They examined everything from small randomized controlled trials to larger observational studies, looking for patterns. The methodology is like having thousands of small experiments, and instead of doing one huge study yourself, you're standing back and saying, what do all of these smaller studies, done by different teams across different countries, actually agree on? They looked at exercise programs ranging from aerobic training, think jogging or cycling, to resistance training, to combined approaches. They tracked outcomes like cardiovascular fitness, metabolic markers like blood sugar and cholesterol, immune function, and the development of actual diseases like heart disease and diabetes. It's the difference between asking, does exercise help, and asking exactly how much does exercise help, and in what specific ways. The findings were striking in their consistency. First, people living with HIV who exercised regularly showed significant improvements in cardiovascular fitness. We're talking 15 to 25% increases in their VO2 max, which is basically their aerobic capacity. That's substantial. Second, they saw metabolic improvements that absolutely matter. Better blood sugar control, improved cholesterol profiles, and better insulin sensitivity. These aren't minor adjustments. These are the exact things that prevent diabetes and heart disease. Third, and this is where it gets genuinely exciting, exercise appeared to improve immune function in ways that pharmaceutical interventions haven't fully achieved. Certain immune markers improved. The chronic inflammation that characterizes HIV, even when the virus is suppressed, appeared to decrease. Here's the practical translation. In the general population, consistent exercise reduces your risk of developing type 2 diabetes by maybe 40 to 50%. In people living with HIV, the magnitude was similar, or sometimes even better. Resistance training appeared particularly effective at preventing some of the metabolic complications. The effect sizes weren't tiny. These were the kinds of improvements that genuinely translate into living longer, healthier lives. And importantly, these benefits accumulated regardless of what antiretroviral medications people were taking. So what does this mean for actual human beings? If you're living with HIV and you've been told to take it easy, here's what the evidence now suggests. That advice was wrong. Exercise isn't just tolerable for your immune system, it might be one of the best things you can do for it. We're not talking about extreme fitness here. Moderate aerobic activity, 3 to 5 times a week, combined with some resistance training, appears to deliver these benefits. That's walking, cycling, swimming. Things that are accessible. The practical barrier isn't biological, it's usually access and stigma. Some people living with HIV don't want to show up at a gym because of fear of discrimination, which is infuriating because the stigma is the only actual barrier here. The research is also honest about what we don't know completely. Individual responses vary. Some people will benefit more than others. And this doesn't replace antiretroviral therapy. These medications are still foundational. But exercise appears to act as a force multiplier, making everything else work better. It's like the medications handle the virus, while exercise handles the collateral damage. Where does this fit in the bigger picture of HIV care and prevention? We've spent the last 30 years basically perfecting antiretroviral therapy. We've gotten incredibly good at suppressing the virus. But the field has been slower to address what happens after suppression. The chronic inflammation, the metabolic complications, the premature aging that many people with HIV experience. This research suggests that exercise should be integrated into standard HIV care from the beginning, not treated as optional. It raises interesting questions. Why isn't exercise prescription as standardized in HIV clinics as it is in cardiac rehabilitation? If we know exercise prevents disease as effectively as certain medications, should we be funding gym memberships as part of treatment? What would happen if we had supervised exercise programs embedded in HIV clinics? The next research frontier probably involves figuring out the optimal exercise prescription. Exactly how much, what type, what intensity produces the best long-term outcomes. And we need to figure out how to actually implement this in real-world clinical settings, especially in resource-limited areas where people living with HIV often face the most barriers. Turns out, one of the most important medications for people living with HIV isn't a medication at all. It's movement. It's your own body, consistently pushed to do hard things. It's the thing that's been available the entire time, that costs almost nothing, that has minimal side effects, and that our medical culture treated as optional rather than essential. The question we should be asking isn't whether people living with HIV can exercise safely. The evidence is clear they can. The question is, why did it take until 2026 for us to systematically prove what probably should have been obvious decades ago? Turns out scientists have been busy, and they're not done yet.